The health authority tells us the person is a man in his 60s. He had recently travelled to Egypt. He returned back to Saskatoon on the 6th of March and he was tested on the 9th. Then that person late last night was advised by authorities that they believed he had COVID-19 and they announced it publicly early this morning. Now that person is now self-isolating and there are currently 2 paramedics and 4 firefighters who are also isolated in Saskatoon. They attended to a patient yesterday who was later tested for COVID-19. They didn't know at the time that that patient was a risk. Morgan Harkle, the fire chief in Saskatoon, he says that their processes are now being reviewed.
There's a number of operational steps that we are reviewing right now. One of those is being the dispatchers and the questions they ask the patient or the caller for the patient.
Anyone with a cough or other symptoms that makes them believe they have COVID-19 is being asked to stay home. They're also being asked to contact the health line 811 if they do believe they have symptoms, but there are long waits for that hotline, so only people with symptoms should call, not people with general questions. That's according to the Saskatchewan Chief Medical Health Officer. We heard from him this morning.
We are trying to ramp up the capacity to advise, assess and test as the demand increases, and it's very important to do that.
The Health Minister says the province is working on an action plan to reduce wait times for that 811 health line, and that action plan is due tomorrow. The Health Minister says that they are expecting more presumptive cases in Saskatchewan and that the public will be notified as that happens. Alicia Bridges, CBC News, Saskatoon.